Head and neck cancer. Introduction. Head and neck cancer is a fairly common cancer. Cancer of the oral cavity, salivary glands, paranasal sinuses and nasal cavity, pharynx, larynx, and lymph nodes are considered cancers of the head and neck. More than 500,000 people are diagnosed with head and neck cancer each year across the world. Head and neck cancer may be cured if found early. The following types of cancer are not usually grouped with cancers of the head and neck: cancers of the brain, cancer of the eye, thyroid cancer, cancer of the scalp, skin, or muscles, cancer of the bones of the head and neck. This program will help you better understand what head and neck cancer is and what treatment options are available. Cancer. The body is made up of very small cells. Normal cells in the body grow and die in a controlled way. Sometimes cells keep dividing and growing in an uncontrolled way, causing an abnormal growth called a tumor. If the tumor does not invade nearby tissues and body parts, it is called a benign tumor or non-cancerous growth. Benign tumors are almost never life-threatening. If the tumor invades nearby tissues and body parts, it is called a malignant tumor or cancer. Cancerous cells spread to different parts of the body through blood vessels and lymph channels. Lymph is a clear fluid produced by the body that drains waste from cells. It travels through special vessels and bean-shaped structures called lymph nodes. Cancers in the body are given names depending on where the cancer started. For example, cancer that begins in the oral cavity will always be called oral cancer, even if it spreads to other places. Cancer that moves from one tissue to other body parts is known as metastatic cancer. Most head and neck cancers begin in the cells that line the mucosal surfaces in the head and neck area, such as the mouth, nose, and throat. Mucosal surfaces are moist tissues lining hollow organs and cavities of the body open to the environment. All tumors are cancerous. Select true or false. Correct. Only malignant tumors which have the potential to invade other tissues are cancerous. Benign tumors are not cancerous. What is the name of a tumor that invades other organs and body parts? Choose one of the following options. 1. Malignant tumor. 2. Cancer. 3. Metastatic cancer. 4. All of the above. Correct. Cancer of the head and neck. Cancers of the head and neck are identified by the area in which they begin and include cancers of the oral cavity and nasal cavity. Cancers of the oral cavity include cancer of the salivary glands, cancer of the paranasal sinuses. Cancer of the nasal cavity includes cancer of the pharynx, cancer of the larynx, cancer of the lymph nodes. The pharynx is a hollow tube about 5 inches long that starts behind the nose and leads to the esophagus and the trachea. The esophagus is the tube that goes to the stomach. The pharynx has 3 parts. Nasopharynx. The nasopharynx is the upper part of the pharynx and is behind the nose. Oropharynx. The oropharynx is the middle part of the pharynx and includes the soft palate, base of the tongue, and tonsils. Hypotharynx. The hypotharynx is the lower part of the pharynx. The larynx, also called the voice box, is a short passageway formed by cartilage just below the pharynx in the neck. The larynx contains the vocal cords. Causes and risk factors. It is usually impossible to specify the cause of cancer in an individual patient, but we do know what causes cancer in general. Healthcare providers also know factors that can increase the chances of getting cancer. These are known as risk factors. The most important risk factors for head and neck cancers are tobacco and alcohol use. 85% of head and neck cancers are linked to tobacco use. People who use both tobacco and alcohol are at greater risk for developing head and neck cancers than people who use either tobacco or alcohol alone. Other risk factors are associated with the area in which cancer starts. Risk factors for cancer that begins in the oral cavity include sun exposure to the lip and possibly infection by the human papillomavirus, or HPV. Radiation to the head and neck is a risk factor for cancer beginning in the salivary glands. Exposure to radiation can come from X-rays or from radiation therapy for certain medical conditions. Certain industrial exposures can raise a person's risk of cancer beginning in the paranasal sinuses and nasal cavity. Examples are breathing in wood or nickel dust. Tobacco and alcohol use may play less of a role in this type of cancer. Cancer that begins in the nasopharynx has multiple risk factors. Repeated exposure to wood dust and the consumption of certain preservatives or salted foods increases a person's risk of cancer beginning in the nasopharynx. Other risk factors are infection from the Epstein-Barr virus and an Asian, particularly Chinese, ancestry. The risk factor for cancer beginning in the oropharynx is poor oral hygiene. Other possible risk factors are HPV infection and the use of mouthwash that has high alcohol content. Exposure to airborne particles of asbestos, especially in the workplace, increases a person's risk of larynx cancer. People who are at risk of developing head and neck cancers should talk with their healthcare provider about ways to reduce their risk. It is always possible to determine the cause of cancer in a patient. Select true or false. Correct. It is not possible to specify the cause of cancer in an individual patient. Having a risk factor for cancer means you will get cancer. Select true or false. Correct. Having a risk factor for a cancer increases the chances of developing this cancer. It does not mean the person will develop the cancer. 85% of head and neck cancers are linked to tobacco use. Select true or false. Correct. The most important risk factors for head and neck cancers are tobacco and alcohol use. Symptoms. General symptoms of head and neck cancers include a lump or sore that does not heal, a sore throat that does not go away, difficulty swallowing, a change or hoarseness in the voice. Other symptoms are associated with where the cancer begins. Select the type of cancer to learn about its symptoms. Oral cavity, nasal cavity, salivary glands, oropharynx and hypopharynx, nasopharynx, larynx. The symptoms of cancer are similar to symptoms of other diseases. It is important to check with a healthcare provider about any of these symptoms. Diagnosis. The best way to treat head and neck cancer is by finding it very early. It is sometimes possible to find this type of cancer even before it causes any symptoms. If you have symptoms of head and neck cancer, your healthcare provider will try to find out if cancer is the cause of your symptoms or if there is another cause. The healthcare provider may perform a physical exam to look at your oral and nasal cavities, neck, throat, and tongue using a small mirror and light. A physical exam may also include the healthcare provider feeling for lumps on the neck, lips, gums, and cheeks. An endoscopy may be used to examine larynx, esophagus, nasal cavity, and nasopharynx. During an endoscopy, the healthcare provider uses a thin, lighted tube called an endoscope to examine areas inside the body. Laboratory tests may examine samples of blood, urine, or other substances from the body. X-rays create images of areas inside the head and neck on film. Another test to diagnose head and neck cancer is called a CT scan. A CAT scan takes detailed pictures of areas inside the head and neck. An MRI is also used to make detailed pictures of areas inside your body. A PET scan uses safe radioactive sugar that is modified in a specific way so it is absorbed by cancer cells and appears as dark areas on the scan. The sugar is injected into a vein, and a scanner makes detailed pictures of where cancer cells are located in the body. A biopsy is the only sure way to know if a person has cancer. A biopsy is the removal of tissue. A pathologist studies the tissue under a microscope to look for cancer cells. If you have head and neck cancer, your healthcare provider will determine the stage of the cancer. Staging is an attempt to find out if the cancer is spread, and if so, to which parts of the body. Stages are usually described using the numbers 1 through 4. A lower number indicates an earlier stage. Staging is helpful in deciding the best course of treatment. Staging head and neck cancer may involve surgery, X-rays, and other imaging procedures and laboratory tests. A biopsy is the only sure way to know if a person has head and neck cancer. Select true or false. Correct. A pathologist studies the tissue under a microscope to look for cancer cells and confirm the diagnosis of head and neck cancer. Stage 1 cancer is more dangerous and advanced than Stage 4. Select true or false. Correct. Stage 1 cancer is less advanced than Stage 4. This means it is usually more treatable. Treatment and supportive care. Treatment for head and neck cancer depends on the location of the tumor, the stage of cancer, and the person's age and general health. Talk to your healthcare provider about each treatment option and the side effects associated with them. Head and neck cancer can be treated with surgery. The surgeon may remove the cancer and some of the healthy tissue around it. Surgery may be followed by radiation. If the healthcare provider suspects the cancer has spread, lymph nodes in the neck may also be removed. This is called a lymph node dissection. Radiation therapy, also called radiotherapy, involves the use of high-energy X-rays to kill cancer cells. Radiation therapy may be done externally or internally. External radiation comes from a machine outside the body. Internal radiation comes from radioactive materials placed directly into or near the area where cancer cells are found. Chemotherapy is another treatment option for head and neck cancer. This treatment is used to kill cancer cells throughout the body using very strong chemicals, sometimes called anti-cancer drugs. There may be clinical trials available for people with head and neck cancer. Clinical trials test new medical approaches and treatments. Treatment for head and neck cancer depends on the location of the tumor, the stage of the cancer, and the person's age and general health. Select true or false. Correct. Talk to your healthcare provider about treatment options and the side effects associated with them. Summary. Head and neck cancer is a fairly common cancer. Worldwide, more than 500,000 people are diagnosed with head and neck cancer each year. About 85% of head and neck cancers are linked to tobacco use. Cancer of the oral cavity, salivary glands, paranasal sinuses, and nasal cavity, pharynx, larynx, and lymph nodes are considered cancers of the head and neck. Cancers of the brain, eye, and thyroid, as well as those of the scalp, skin, muscles, and bones of the head and neck are not usually grouped with cancers of the head and neck. The treatment for head and neck cancer depends on the location of the tumor, the stage of cancer, and the person's age and general health. Options include surgery, radiation therapy, and chemotherapy. Thanks to advances in medical treatment and technology, it is now possible to cure head and neck cancer if the cancer is found early. If the cancer is not found very early, then the earlier it is found, the better the chance for successful treatment.